this is Priyanka and Akila from Let's Update Language Academy with yet another roleplay card presentation, and it's of last March examinations roleplay card. And should we have to say that it's latest?
Yes, of course it is.
So it is latest card. So Let's Update Language Academy always promise the latest cards to you for your better experience in practice before the examination. And once again, I remind you that for the cards, you can search our Telegram group. You'll get all the previous cards of examination. So please do search, and you'll be getting a lot of tips and information about the cards, as well as letter, and so many reading and listening materials are also uploaded in the Telegram group. You can search for it and you'll get this card too. So we are here to present a roleplay card of 20-year-old patient who's going to travel around Africa, and it's about anti-malarials. So I was reminded of one thing, Akila, that is this type of card was asked in the examination, and this is the third time. I think I've mentioned.
Yes, you have already. Third time you have mentioned.
This is the third card of the same content and same topic, and there are some differences, but it's almost the same.
Similar.
Yeah. So I think this carries a lot of importance. So please do listen, and I think we can provide you all the previous cards of the anti-malarial, so that will be definitely helpful for you, isn't it?
Yes.
Okay, so shall we start?
Yeah.
Okay, so shall we play the role of the nurse or the candidate, and I'll be playing the role of the patient or the interlocutor. So here we go. Okay.
So during roleplay card, how may I address you?
You can call me Priyanka.
Okay. Shall we start?
Yes, please.
Hi Priyanka, my name is Akila John. I'm a registered nurse working in this clinic.
Okay.
So I'll be taking care of you today.
Alright, thank you.
So Priyanka, could you please tell me what is the purpose behind your visit?
Well, thank you, nurse. I'm going to traveling around Africa to do a work experience for 3 months. It's a veterinary wildlife internship. So I have read online that there is a chance of malaria, and so I really need to take anti-malarial tablets, but to be frank, I don't want to take them. So I'm here to get some advice from your side of what are the other options, or is it absolutely necessary for me? So can you help me?
Yes, sure. I'm glad that Priyanka, you made such a appreciable decision to come here to know more regarding this medication and all. It's really good thing from your side.
Okay.
So Priyanka, prior to that, I would like to collect some information regarding your
Sure.
health.
Okay. Yeah, sure.
Would you mind if I'm asking some questions?
No problem. Please carry on.
Okay. Could you please tell me, like, are you taking any current medications?
Well, no. I'm for a long time not taking any kind of medication.
That's good. So, are you in any kind of any medical conditions?
No, I'm not.
Okay, that's clear. So, Priyanka, you have mentioned you are not willing, or you are not in a need necessary to take this tablets, right?
Yes.
So, could you please tell me what is the reason behind your non-compliance? Like, have you got any previous problems or any side effects like that?
Well, that's a good question, nurse. Actually, I haven't taken this anti-malarials before, and I understand that I have to take for a long time, and I'm worried about the side effects. So that really doesn't sound so good.
Okay, I can understand that you are expecting some of the side effects, right?
Yes.
Okay.
And I was also thinking that, isn't it the insect repellent and also the mosquito net? Is that enough to prevent this malaria?
Yeah, that was very good question from your side. I will be explaining you in detail. Prior to that, let me share you some of the other important information.
Yeah, please carry on.
Sure, okay. So, Priyanka, I am strongly suggesting you that there are a range of tablets for this malaria. Okay. It can vary according to the duration. Like, some will be short term, some will be long term, and it will be having mild side effects. As all medication, we are expecting a mild side effects. Okay.
Alright.
And according to your duration of that work, you can select the medication.
Okay.
Sometimes you will be staying there for 1 week, for 1 month. So the duration stay can be varied according to the medication.
Okay.
Now, do you get a better picture regarding that?
Yeah, that was very good information.
Okay, I'm glad I could give you such information.
Thank you so much, nurse.
So yes, Priyanka, you had asked a very relevant question to me about the using of the mosquito and insect repellents. Am I right?
Yes.
So I'm strongly suggesting, I'm afraid no, because dear, we can't completely guarantee like the effectiveness of the insect repellent.
Okay.
It is like a 50% chance.
Okay.
Definitely it's recommendable to use this insect or mosquito repellents along with the medication.
Okay.
I hope that was clear to you.
Yes.
Okay, that's good. And see, Priyanka, I would like to give more information regarding the malaria.
Okay.
May I?
Yeah, please. That
Okay.
would be great information for me.
Yeah, yes. Malaria is actually it's caused by mosquito bites. You may be knowing that.
Okay. Yes.
Yes, and it's very severe and recurrently it can happen.
Okay.
Okay, and also the malaria is giving serious complications for us.
All right.
So it's always good to prevent this
Okay.
with these tablets.
All
Okay.
right. Okay.
Okay. Then would you mind if you're sharing some information regarding your work?
Yeah, please ask me.
Okay, sure. So when is your departure date, Priyanka?
I can say a few months after.
Okay, few months.
Yes.
Okay, then what kind of work you're planning to do there in Africa?
Well, I think I've mentioned to you, it's actually a veterinary wildlife internship. So I'll be dealing more with the vets.
Oh, that's actually your profession is something very interesting.
Yeah, thank you so much. But I afraid my location would be most of the time in the rural areas.
Yes, yes. So it can be an increased risk of getting this kind of infections. Right?
Okay, okay.
Okay. Then may I like recommend this malarial medication to you?
Yeah, no problem. In this case, I understand the importance of malarial medication. So please.
Yes, actually this malaria medication, we are using that we can approximately prevent about 90% of risk, and I'm advising you strongly to take this medication.
Okay.
So would you mind if you're making an appointment with me prior to this departure date?
Definitely. Then I think I'll take a next week appointment and I'll think carefully about this anti-malarials and I hope I can take a good decision on that.
Yeah, okay. So it is recommendable to take about 8 to 12 weeks prior to a departure date.
Okay.
And on that time, at that visit, we can deal more regarding the vaccination and everything.
Okay.
And also the medication.
All right.
And hope everything was clear to you.
Yes, that was pretty clear to me.
So, Priyanka, do you have any further queries or concerns?
No, it was pretty clear to me.
So, I'm glad that I could clarify all your doubts. In case if you are having any further, please free to contact our helpline number, which will be, I think, which is already with you.
Yes, thank you so much.
So, thank you, Priyanka, for coming here and patiently listening to me.
Okay, thank you so much. So, that was a very wonderful performance from Akila. And I was playing just a role of a patient, so you could actually give me a lot of information about the anti-malarials and malaria as a condition. But before that, I think that maybe the last conclusion parts you may not actually going to say in the examination because time was up already. Okay,
yes,
so
yes.
I didn't bother this time because this would be a great information for our audience who will be practicing this. So maybe a few lines at the end. So yes. Few lines at the end, but that's not a problem. Maybe in the examination the interlocutor themselves would say that the time is up and we can stop right away. But I'm sure that you'll be able to complete the whole task and you did it very good. And this was actually a tricky task. Usually I say this, that's an unknown case, so most of the time unknown cases are quite easy for the students because introduction part and the information in the initial part will be given by the patient, isn't it? Yes. But this time this card was a bit tricky about the information about anti-malarials was a bit tricky. You handled it very well and it was very natural. And I should point out one thing was, I actually set a point before what you have to deliver, right? So I overset a point, but she managed it very well. But I can say this can absolutely happen in your examination too. So you have to be very careful. Though we are following the order, there is a chance from the interlocutor side to say the information prior to your response. But even then, you'll have to manage it. In her case, she has said that you have you have asked a genuine concern. That was very important. But before that, can I ask you, or can I give you some information about
more important information?
Yes, some more important information about anti-malarial. So that's how she handled the situation. This is a very important thing that you should note. You'll be able to, I mean, you should be flexible enough to handle the situation. Yes. So, do you want to add anything?
No, ma'am, everything I think she's mentioned everything.
All right, fine. So I think this card, all the candidates who are preparing, you must practice, and we'll be giving it in our Telegram group. So keep watching us. We'll be coming with more videos. Thanks from Priyanka.
And thanks from Akhila.
Thank you. Bye.
Thank you.